Nice to see everybody in their appropriately assigned seats. So good afternoon. Today we're going to talk some about the work that's being done by large employers in preparation for reopening, as well as some updates on funding for municipalities as they fight COVID-19, and a new virtual map where residents can more easily find testing sites. Now that we have, 50 and we're on our way to 60? Is that? Yeah. I'll start with our daily update on testing and positive cases and hospitalization numbers. Yesterday, over 14,300 tests were reported to DPH, which brings us to a total of over 424,000 tests conducted so far. The positive test rate for these tests was around 12%, which is in line with the positive test rate percentages we've seen over the last week or so. We're cautiously optimistic about this number. It's obviously down significantly from where it was in the middle of April, but we're going to continue to keep a close eye on it. As we outlined yesterday, we're submitting our plan to the federal government later this month to further increase our testing capacity to 45,000 tests a day by the end of July and 75,000 tests a day by the end of December. And the Department of Public Health has updated its guidelines to expand the number of people who can get tested, and the Division of Insurance has provided guidance to insurers about payment of testing for symptomatic and asymptomatic individuals who are identified as close contacts of those who do test positive through our contact tracing program. Going forward, more people who are close contacts, people with mild symptoms, and other frontline workers can expect to get tested. Pushing forward on testing will be a critical part of getting Massachusetts back to work, while at the same time continue to track, contain, and battle the virus. And we're pursuing measures every day to meet these goals. There were 1,685 new cases reported yesterday. The percentage of cases that are currently hospitalized is down to 3%, which is trending in the right direction, and we have 242 fewer people hospitalized from COVID yesterday than the day before. We still have over 2,800 people, however, who are hospitalized from COVID here in the Commonwealth. But fortunately, our hospitals have been able to withstand the surge and continue to be able to care for everyone who's seeking medical attention. But we're still one of the hardest hit states in the country, and we continue to have daily conversations with our leaders in the healthcare community to monitor these numbers and get updated from them on what they're seeing every day on the ground in their own institutions. On personal protective equipment, we've distributed over 10.6 million pieces of PPE, including masks, gowns, gloves, and ventilators to frontline workers, first responders, and healthcare workers. We'll continue to work tirelessly to get as much PPE as we possibly can to ensure that our workers who need it most have the protection they need as they continue this fight. As we work to plan for a phased reopening of the Massachusetts economy, we've been in constant communication with the private sector about how they best prepare their workforces for the next phases. An important part of this conversation is centered around continuing to give employees the ability to work remotely or work from home. We're grateful for the private sector's incredible flexibility, creativity, and willingness over the past few months to step up with creative solutions for allowing their workforce to work remotely. Now, as we look to the weeks and months ahead, we're urging businesses to continue to promote remote work and work from home as much as possible. We know there's no one-size-fits-all approach to this. Not everyone can work remotely, and some employers will be required to have their employees physically report to a place of employment to fulfill a shift, operate a machine, or take care of customers. But there are hundreds of companies and thousands of employees who are now successfully working remotely. And as we start to transition to slowly reopening our economy, it's become more and more critical for remote work to continue so that we can continue to fight COVID-19 and prevent the spread of infection. Public health experts have made clear that large numbers of people in enclosed spaces is exactly how this virus spreads. That's part of the reason why many of the general guidance that we've put out there to businesses as we go through this reopening process from the Reopening Advisory Board make absolutely clear that distance at work will be a fundamental requirement for everybody. We all know that COVID-19 is highly contagious, spreads through droplets, or can live on hard surfaces, and can be transmitted if people are in close proximity. Since late March, approximately half of the executive branch workforce that works with the Lieutenant Governor, myself, and our cabinet has been working remotely or working from home. This week, we extended our current policies with respect to remote work and working from home for the foreseeable future. And today, we're pleased to announce a growing list of employers committed to continue their work from home policies and remote work policies for the foreseeable future as well. These companies include some of the largest employers in the Commonwealth. Companies like Blue Cross Blue Shield, Raytheon, Wayfair, MassMutual, and Takeda total around 150,000 employees. By extending work from home policies and remote work policies, employers in many cases are supporting their employees, especially those who are at high risk, and at the same time fighting back against the virus by preventing more spread. We've heard feedback from many of these companies on the successes that they've had transitioning to more remote working, and I'd like to share some of what we've heard. At Raytheon, they're allowing half of their global workforce, about 100,000 employees, to work from home or work remotely. This not only helps them focus on protecting their employees that must work on site, but also results in fewer people being out in public, helping to minimize the spread of the virus. It also limits the number of people who are actually working on site. The new rules for everybody associated with work in an office are going to require people to create distance. One way you create distance and make it work is by not having the same number of people show up in the same office as you did before. To the extent the companies can find ways to make remote work or work from home work, even if it's only a few days a week, and if they can create a rotational process to involve that, it makes it much easier for them to create the distance that they are required to pursue under the order that we are issuing on Monday to make it work for them and for their workers. Blue Cross Blue Shield of Mass has 98% of their associates currently working from home. And while they're working on plans to reopen their buildings when appropriate, they're continuing their remote work arrangements for the foreseeable future. And at Takeda, they're continuing to support remote working wherever possible, which reduces both how many people are in their physical offices. Again, the distancing thing is critically important, and it also cuts down on the number who need to commute. I also want to say thanks again to all those employers who are coming up with strategies to work with us and with our administration to reimagine what their workplaces can look like and perform, and what we need to do with them to continue to adapt and fight the virus. But as we reopen the economy, we certainly anticipate that some state agencies will start to have certain employees return to the workplace on a full-time, part-time, or intermittent basis in the weeks ahead to help restart some state services that are currently paused, operating on a limited basis or being provided through a modified approach. Many of those government operations are critical to getting us all back to the new normal that we're shooting for, and we'll have more to say about the details on that soon. And we definitely appreciate all the work and the creativity and the imagination that our workforce has put in over the last couple of months to keep the executive branch operating during these very unusual circumstances. I also want to give an update on the funding to support the Commonwealth cities and towns as they battle the virus that we put out yesterday. We gave guidance to local officials that represents around $715 million that we're planning to distribute from the Federal Coronavirus Relief Fund to cities and towns for eligible costs related to their COVID-19 response efforts. This aid is $502 million from the Commonwealth, and then direct support of $90 million to Plymouth County and $121 million to the City of Boston. That represents about 25% of the total funding the Commonwealth has received from the Federal Coronavirus Relief Fund. We also expect this funding will address incurred or expected eligible COVID-related expenses by cities and towns. And the Executive Office of Administration and Finance will continue to work closely with our local officials to distribute this aid, account for it, and make sure that all the reporting and documentation that we need to meet federal guidelines is taken care of appropriately and accurately. Earlier this spring, Many people here know that we worked with the legislature to come up with a plan to move the tax filing deadline from April 15th to July 15th to give tax filers more flexibility during this crisis and match our extension to the federal extension as well. Today, I signed the legislation that will help finance this move and help protect this year's state finances. I want to thank Speaker DeLeo, Senate President Spilka, House Ways and Means Chair Aaron Michowitz, Senate Ways and Means Chair Mike Rodrigues, and the members of both the House and the Senate for making this bill happen during this particularly unusual part of the legislative session. And I think, as many people know, on Monday, our Reopening Advisory Board will be releasing their report on recommendations for a phased reopening of the Massachusetts economy. We know that everyone is more than ready for things to get back to normal, and believe me, so are we. As a housekeeping item, this weekend, our legal office will be posting a 24-hour extension of the essential services order we issued previously, which I think, as everybody knows, expires at midnight on Sunday. To be clear, this is simply a technical extension. It doesn't change anything. It just allows us to move to the next step, which we'll be outlining with you all on Monday. It's important to remember that we have plenty of things we can do in this fight against the virus. In fact, it's pretty much the only way the Commonwealth can move forward, and it will require everybody to continue to play their part. You've all heard me say this before. I'm going to say it again. Cover your face in public. Masks and face coverings can cut transmission down by as much as 80%. A simple cloth mask is almost as good as one purchased. And this is about protecting those around you as much as it is about protecting yourself, especially given the level of asymptomatic carrier that exists out there in the regular population. Maintain that 6-foot distance wherever you can. Everybody knows about that one. Wash your hands. The science is clear. Lots of hand washing, 20 seconds, simple soap and water kills the virus. And the fourth is to do everything you can to stay home if you feel sick. Do not go to work if you're not up for it. These things are the things that were within our control, and doing them every single day is a big part of how we defeat the virus. And finally, I'd like to end on some good news. Starting today, the Command Center has launched a virtual map where residents can easily locate a testing location in their area. We currently have over 250 testing sites throughout the Commonwealth, and this tool will help people easily find a testing site close to them if they need to be tested. If you have symptoms of COVID-19, have been in close contact with someone who has COVID, please get tested. To the residents of the Commonwealth, I just want to say once again, thank you for doing your part. It's about getting that job done that's made so much of a difference so far, but we obviously have work to do. We've asked a lot of you during the past couple of months, and you've shown the best of what Massachusetts has to offer, and I thank you for that, and we look forward to continuing to fight this virus as we reopen going forward. I'd now like to welcome Secretary Sutters to the podium to talk more about the virtual map and more testing sites that are coming online.
Good afternoon. Thank you, Governor, Lieutenant Governor. So as the Governor just noted, the Command Center has used the expertise of our colleagues at MEMA in standing up an interactive COVID-19 test site locator map that individuals can use to easily find where COVID-19 testing locations are. The test site locator searches for testing sites by zip code or city-town and quickly provides information about testing location hours and protocols. I checked it yesterday to make sure it worked. The Command Center has aggregated the more than 250 different locations into a consumer-friendly tool that can be found at mass.gov/COVID-testmap. The info on the map is constantly changing and being updated, so we encourage people to contact the test site for details before actually going to a test. We couldn't actually do the live demonstration for you by putting in somebody's zip code, but it's quite user-friendly. And just one more update about testing. In a partnership with Walmart, we are opening COVID testing sites starting today at the parking areas at their Salem, Brockton, Quincy, and Plymouth stores. The sites are supported by Walmart, eTrue North, and state and local officials to test anyone who meets the CDC and state guidelines. Those interested in being tested should visit www.doineedacovidtest.com to see if eligible for testing and to make the appointment. So beginning today, the site is open, and it will be open Monday, Wednesdays, and Fridays from 7 a.m. to 9 a.m., obviously weather permitting. And each site will be about to test 40 to 50 people a day. So that's about an additional 600 tests a week. The site will use a self-administered nasal swab test that will allow those being tested to swab their own nose on site while in their vehicles and observed by a trained medical professional to ensure that the sample is taken correctly, and then dropped in a sealed sample into a container on their way out of the drive-through site. eTrue North, who is Walmart's partner, Walmart's partner, will handle both the processing test samples, which will be turned around within days, and communicating the results to those treated and tested and applicable departments of health. The site will be staffed by Walmart healthcare professionals. We're grateful to Walmart, which expects to add COVID testing sites at other locations throughout Massachusetts in the coming weeks, for expanding testing capacity in the Commonwealth as we try to achieve our goals. Governor?
Questions?
Governor, Boston Mayor Marty Walsh announced his public health emergency would be staying in place. Do you anticipate extending the states? And also, the results of that news flash is on 9% of people in Boston have not been exposed. I just wonder how much stock you put in that and who is going to be okay.
So, obviously, the knowledge about COVID has changed a lot over the last 60, 70, 80 days. And I have a stack of sort of articles on my desk that date back to February of smart things that people wrote about the virus. And if you go back to sort of February-ish or so, a lot of the writing about COVID talked about an asymptomatic population that might be as much as 5%. And it talked about the fact that in addition to that, some of the folks who would get COVID and become symptomatic might be asymptomatic for a couple of days beforehand, okay? People now believe that, and it's a fluctuating number, that somewhere between 20 and 50% of the people who get COVID are carriers, have it, legitimately have it, are never going to show any symptoms at all. And because of that, the estimates about how many people in Massachusetts or how many people generally, if you're in places where there's been a pretty significant outbreak, which we certainly qualify for, the estimates about how big a population may actually have already had COVID or been exposed to it, and if they got tested with an accurate antibody test, would probably test positive for that, is somewhere between 7 and 10%. And so the number I've heard people who know what they're talking about in Massachusetts talk about is that probably somewhere between 7 and 10% of the population has been exposed enough to COVID that they would have antibodies. So that test result is pretty consistent with what a lot of the academics and researchers have said they think the level of positive exposure in Massachusetts would look like. Although you would never have had that big a percentage of the population who would show, because such a big piece of it is asymptomatic.
What does that tell you as you consider your reopening and also speak to his guidance on the public health emergency?
Well, the biggest thing it says to me is wear a mask, wear a face covering. I mean, if such a significant portion of the population that gets this virus and is a carrier and can give it to somebody else isn't going to be asymptomatic, isn't going to know they have it, the most important thing you can do to protect your friends, to protect your family, to protect your coworkers, to protect anybody you come in contact with, is to wear a face covering or a mask so that you don't give it to them. And it would also be, from my point of view, the appropriate thing for any of us to do when we're out in public and we can't be 6 feet or more away from people, which is why the reason we issued our advisory around face coverings was as the information associated with just how prevalent asymptomatic transmission had become. And I said at the time, you know, if you want to wear the mask to protect yourself from other people, that's great. But the other thing you need to understand is by wearing that face covering, wearing that mask, you may in fact be protecting other people from you because you're an unknowing carrier because you're asymptomatic. And this is going to continue to be one of the biggest challenges in really understanding the nature of this virus, which is why every time I come here, I talk about how, you know, you really want to slow the infection? Wear a face covering. Stay 6 feet away from people. Wash your hands as often as possible. Disinfect and clean surfaces on a regular basis and use hand sanitizer. I mean, the whole issue around what you can do as an individual to help stop the spread on this is real.
Governor, more communities are launching antibody testing. Do you plan to use those results to help guide reopening as those results come back? And should employees use antibody tests to decide who returns to work?
Well, my view all along on antibody testing, and I've said this to you before, is I'm waiting to get sort of a sign-off from the feds that there are in fact tests that you can do on a larger basis, on a grander scale, that are going to be accurate, okay? I mean, we brought this up the other day with the medical advisory board that advises the command center, and they continue to be concerned about the fact that there isn't yet a quote-unquote gold standard. Now, if you have MGH running your testing protocol, which is what the city of Boston did, I don't worry about whether or not those are going to be accurate. And it was also a small sample in particular areas where they were sort of testing this. But I think this is a great example of where the federal government can make an enormous difference. If the federal government can do the work, do it quickly, and get guidance and advice out to folks like us and to people in the medical community and to researchers and employers and others, that these tests done this way will give you the 95% plus accuracy reading that everybody's looking for with respect to antibodies, then as a surveillance tool, they become pretty important. And I fully expect that we did talk about, we're going to have that in our application, right? That is going to be one of the ways we do surveillance, absolutely. But I would really like the feds to do the work and sign off what they consider to be, you know, sort of the 2 or 3 or whatever the number is, most accurate and best test to do antibody testing.
Governor, a group of state lawmakers...
Because one other thing I just want to say about that, remember, antibody test tells you who had it, right? It doesn't necessarily answer a question about how strong their immunity is or how long it's going to last, okay? That's another coronavirus question that's still being researched and debated. And it also doesn't tell you that much about who's going to get it. And I worry that, you know, people get very binary about some of this stuff. So there's been stories written about this idea of getting an immunity card. Well, an immunity card isn't worth a lot if we don't really have a lot of experience and a lot of information about how long your immunity lasts, how legitimate it is, or what it might mean. It's not like 50 years of studying the flu where you can tell people with a certain degree of certainty that if you've had it, you're not going to get it again, at least not until whatever the version is that comes out next year.
Governor, a group of state lawmakers have sent you a letter asking you to extend the stay-at-home advisory and the shutdown of non-essential businesses to June 1st. They say the state hasn't hit certain public health benchmarks, that there's no guidance for businesses, so they're confused. What's your response?
Well, first of all, we've had very positive tracking, as I've said here every day, as I've reported our results for the better part of, well, for some of those measures, it's been for almost a month. And that is a key indicator with respect to where we believe we are and what we think we can do going forward. Part of the reason we've talked about a phased reopening and a go slow reopening is because we want to be conservative and careful and cautious with respect to the way we do this. And part of the reason why we're planning to ramp up our testing capabilities to go from being a top 5 player per capita to probably being the largest per capita tester in the country is because we believe that's an important part of what we need to do going forward as well. And it's also why we started probably 5 weeks ago standing up a tracing program because we think a tracing program is a critically important element as we move forward on this reopening conversation to ensuring that we do what we need to do to contain the virus.
Governor, should people expect the stay-at-home advisory to be lifted or changed by Monday, or is that not?
No, we'll have a lot more to say. That has to be dealt with in the context of the rest of the report that gets issued on Monday.
On the testing question, you said yesterday, I think, that your aim is to get the positive test rate down to 5%.
By the time we fully implement the testing protocols we're talking about, yeah.
By the end of December.
Yeah.
That says quite a bit, doesn't it, about where you think this... So
Well,
5% of what you're testing at the end of December would be positive.
remember, that's if we're doing 75,000 tests a day, that means we're doing 2 million tests a month, okay? And it also means that the phased reopening we've been pursuing has been working the way it's intended to work. It also means that the tracing program is doing all the things that it's supposed to do. I mean, I think of it as I absolutely think of it as an aspirational objective, yeah.
But doesn't that mean there's a lot of infections as well?
Well, like I said, I mean, most people believe that somewhere between 5 and 10% of the population of Massachusetts already had it.
Governor, I'm assuming I can't coach you in a preview on what's coming Monday, so I'm going to leave it aside. But I'm wondering how you feel this is going to be received Monday. Do you have a good feeling about the plan and how people take it?
Well, the first thing I'm going to say is that the Lieutenant Governor and Secretary Keneally and the members of the committee of the board have met with somewhere between 50 and 70, depending on how you define it, 50 to 70 different groups of one kind or another and businesses. And they've done probably 50 or 60 hours of meetings, virtual meetings with people over this period of time. And they've collected a ton of incoming, 6,000 maybe pieces, 3,400. I do tend to, get excited about this. 3,400 pieces of guidance and proposals that have come in through the website. And this proposal is going to be sort of the result of those conversations, those discussions, and the work of the members of the advisory board, along with guidance and support from the command center and from public health. And I think it's a tremendously well-developed and well-thought-out piece of work. But I absolutely know that people who think we're going too fast are going to say, you're going too fast, and people who think we're going too slow are going to say we're going too slow. And I mean, that's kind of where we are here, folks, and that's where we're going to be for a while. And the one thing I would say to everybody is we've said from the beginning that you need to respect the virus. Something that 20 to 40% of the population who gets it can get on an asymptomatic basis and carry and pass on to others, everyone should respect. We've also said that we were going to make sure that we had downward trends across a number of key metrics that I come and talk here every day about for an extended period of time before we would consider a reopening. We also said we were going to get a whole bunch of smart people together, and they were engaged with a whole bunch of folks in the public health and the business side to have a conversation and a discussion about how you take public health guidance and translate it into operating models across different business models and industries, okay? That was all stuff that we said. We also said that when we do this, we want to do it in a way that's cautious enough so that we actually move forward and have the ability to sustain it. And when people say to me, you're not doing enough, my answer to that is, I want to be able to continue to have open businesses and progress on coronavirus in the fall. Because a lot of the folks in the public health community talk about the second wave. In fact, almost every paper that's been written about this talks about the second wave. The best way to make sure we deal properly with the second wave is to be respectful of the virus, to do the things around testing and tracing and hygiene, personal hygiene, that we can all do, and to recognize and understand that this needs to be done carefully. And I'm quite sure that some folks are going to say it's too fast, and some folks are going to say it's not fast enough. and what we believe is based on data, information, guidance, and advice from a lot of very smart people, that this will represent what we consider to be a properly cautious and careful way forward.
So do you feel like you're damned if you do and damned if you don't? There's almost a no win here?
Look, I've said for a while that that this is not anything like what any of us in public life have dealt with before, and because of that, and I keep going back to that stack of reports and papers and stuff that's on my desk. I was sending pictures around to some of you guys from one of the ones that was written back in March by a really smart guy that got, read millions of times and sent all over the globe, and, about half of it was right and half it wasn't, okay? And that's the piece about this that makes going at a relatively cautious and careful pace so important, because the body of knowledge that's associated with what's true changes. The other thing that happens along the way are the tools in the toolbox that are available to you to fight it change too. We talked yesterday about the fact that some of the issues around specimen collection are changing, and the speed with which some of these tests can be conducted are getting faster, and the capacity of the labs to test more quickly continues to grow. And these things will all be factored into how we do with respect to fighting this thing going forward. And the other thing I just have to say, again, especially to the people in Massachusetts, when this all started, people had very horrific assumptions about ventilators, ICU bed days, deaths, all this stuff in Massachusetts, okay? Because people did so many of the right things to stop the spread and slow the spread, and because our healthcare community did a tremendous amount of work to completely redesign themselves to deal with an avalanche of COVID-19 patients, so that they never had to stop taking in the people who were dealing with other healthcare issues. People have done a pretty good job of getting to where we are, and I don't want to lose the benefits that are associated with what people have already accomplished. Because it's been, despite the tragedy that's just everywhere, it's a really impressive story so far. But it doesn't end until we get through the fall. And that means people need to take this thing seriously, they need to respect it, and they need to understand that we got to find a way to help people get back to work. I think everybody knows that, and we got to do it in a way that we believe respects the virus and makes sure that we don't create a second outbreak.
I didn't mean to interrupt, but I'm sorry. On that note, saying that people respect the virus, do the right thing, congratulating people. You never, she doesn't protesters outside or demanding state without that midnight Monday morning. What do you say to those people who simply will not? I'm kind of taking it to accept science and
Yeah.
things, according to the really smart guys you're sitting on your desk, how things need to be opened.
Well, look, as I said in my answer to Jonathan's question, I get the fact that sort of slow and steady is not exactly anybody's idea of bold, okay? But I also happen to believe that the changing nature of what we know about this virus, which is literally like 90 days old at this point, maybe 120 if you go back to sort of when it was just sort of this almost rumor that was coming out of Asia. We know so much more now than we knew then. I don't want to be in a position where we make decisions based on what we think is real that turn out 30 days later to be wrong. And part of the way you deal with that is you are cautious and careful, and you abide by the guidance and the advice from the folks who've spent the most time thinking about this. You put them together with folks in the business community who help you translate guidance and advice into an operating model, and then you recognize and understand that you need to go here at a pace that ensures we have the ability to manage and contain this. Part of the reason we signed up that contact tracing program 6 weeks ago when most other people weren't even thinking about tracing. It's because we knew that would be a way for us to deal with this later on. And they're making 8,000 calls a day now, 12,000 calls. I mean, this thing is really starting to ramp after a fairly, aggressive process of setting it up. And I think the frustration that people feel about wanting to see something more like what things were like before, I totally get it. I totally get it. I would love to be able to, there's so many things I would like, this Friday night, my wife and I usually take a walk down the street and go to one of the local restaurants. That's what we do on Friday nights. We don't do that anymore. The weekend is usually when I go visit my father. I don't do that anymore. My day job, I've talked about this before. My day job and her day job used to be being out there all over the Commonwealth, talking to people, hearing what they were doing, engaging them in discussions about what they were up to. We don't do that anymore. There's a lot of things that have been taken away from all of us that come with this. But the flip side of that is we did bend the trend. We did dramatically flatten the curve. We did learn a lot and hopefully make adjustments based on what we learned with respect to what we can do going forward. And I think it's important for everybody to understand that as we go forward, we're going to be balancing the trade-offs that are pretty obvious, that are associated with public health and people's ability to work. And I think what these folks have done and what we'll report on Monday is a very thoughtful and substantive approach to dealing with this. But I absolutely believe, getting back to Jonathan's comment, that some people are going to say it's too slow and some people are going to say it's too fast. And I understand and I respect that. But this is our idea of the best shot we have at continuing to make progress and not giving the virus a chance to get back out of the barn.
Looking back over the past 8 weeks, and you say the information has changed since then, is there anything that you'd like to have to do over, anything that you did that now knowing what you know, I wish we did that different, did that sooner,
The biggest thing for me is the asymptomatic nature of the virus. I wish I had known more about that earlier, because there's a lot of things everybody would have done differently if we'd known that.
Do you expect you have, we're just a couple days away from the 248 release. Do you feel like you have all the information in here? Is there a piece of information you're still waiting for?
No, I think we feel pretty good about that. You guys did a ton of work. Thanks, everybody.
Beaches.
Could you speak to Memorial Day weekend very quickly? A lot of people are talking about traveling.
Let's talk about Memorial Weekend next weekend. That's next weekend, right? Yeah, we can talk about it next
on that,
week.
though, several states are saying Memorial Day weekend. Some beaches will be open, some with local authority over
Yeah.
it. Is that going to be in the package Monday? Just yes or
I
no?
know you'll be there on Monday, Mike. We can talk then.